BBC investigation has found new concerns that vulnerable patients are at risk of suicide because of a lack of care at a mental health trust. Norfolk and Suffolk is the only trust of its kind to have been put into special measures after being declared unsafe by inspectors in February. But a whistleblower has told the BBC that staff are now so overstretched they are firefighting to keep patients alive. The trust insists it is putting things right. Our health correspondent Sophie Hutchinson has this exclusive report.
This mental health trust is failing patients. Norfolk and Suffolk, previously deemed unsafe by inspectors and put into special measures. Tonight we can reveal new evidence about how patients are still at risk, families desperate for help, and worries from a whistleblower who says some of the most vulnerable patients can't get the right help. For the relatives of patients like 25-year-old Matthew Dunham, the past few years have been unimaginably painful. 2 years ago, the graphic designer became depressed. He told a therapist he couldn't keep safe. Faced with a month-long delay for treatment, he ended his life. His mother is still haunted by what happened to her son.
I think the hardest thing for me is the last picture you have of me to identify his body. When I sleep, that's the picture I see. It's really hard to remember his life because his death was just so awful.
These are the faces of other patients who've died while in the Trust's care over the last 4 years. Stephen Foster, failed by the NHS. Donna Carrigan, allowed to leave hospital despite being a suicide risk. And Luther Benjamin Hughes, let down by the system. There are other mental health trusts in England with greater numbers of deaths reported, but in Norfolk and Suffolk there's been concern about a spike in the number of deaths following cuts to services. A senior clinician working in the community spoke to us on condition of anonymity. She described staff as firefighting to keep patients alive, and said the Trust's bosses still weren't listening.
None of us are getting any kind of hint that people are listening to us, that something is going to change. And we used to say, well, what has to happen? Do people have to start dying? But people started dying, and we're still on the same track.
In a statement, the Trust said the board know what is important, understand where they got it wrong, and are putting it right. They will continue to listen, learn and improve, and will ensure the Trust offers high quality and safe services. But Anne Humphreys says the services are still not safe. Her teenage daughter Bethan has been taken to hospital 10 times following attempted suicides. Anne is desperate for Bethan to get more help, but says despite the Trust promising improvements, nothing has changed. For now, Anne takes turns with her partner to check on Bethan every 30 minutes through the night when she's most vulnerable.
Every time I go to her bedroom to check on her, every time I go to bed, every time I wake up in the morning, my first thought is my child still alive?
Norfolk and Suffolk will go down in NHS history as being the first mental health trust to be put into special measures for its unprecedented failings. Some of the most vulnerable patients have been put at risk here. The Trust says it's investing in more frontline staff, but stressed things will not change overnight. It's now receiving support from a Director of Improvement previously employed to help turn around mid-staffs. The Trust at the centre of one of the worst hospital scandals ever to hit the NHS. Sophie Hutchinson, BBC News.